Across the causeway, according to industry and government sources, more sectors of Malaysia's economy will reopen even when movement control order is extended from Friday.
Beauty and grooming, retail and wholesale retailers, as well as car wash services. Now, these are some businesses expected to end 3 weeks of closure. Manufacturing and construction, which have been the main cause of new clusters this year, will also be expected to abide by tougher and costlier SOPs.
Senior Minister for Security Ismail Sabri Yaakob said yesterday that more leeway is given to economic sectors, especially small businesses, because a full lockdown will be most difficult for the poorest. But he also warned that the authorities will be imposing stricter guidelines and enforcing them more aggressively to curb the virus spread.
The Straits Times' Malaysia Bureau Chief Shannon Teo is here with the latest. Now, Shannon, MCO 1.0 managed to reduce daily COVID-19 infections to single digits. How come this second iteration wasn't as effective?
Well, Ollie, I think for starters, it's a lot looser. In the first MCO last year, practically everything was shut down, except for very specific essential services and businesses that supply that supply chain. So if it's for food, if it's for daily basic necessities, then you're allowed to open. So it was very limited and most people stayed at home. This time, the MCO is aimed more at trying to keep as many people home as possible, but ensuring that it doesn't adversely affect the economy too much. You're still trying to keep the machine purring, as it were. So you get things like manufacturing, like construction, agriculture, and, a wide swath of services as well. They were still operating, but under certain guidelines. But what we've seen, in fact, is that 2/3 of new clusters last month were from these workplaces, the manufacturing sector, the construction sector, things like that. So the very thing we are saying that is crucial for the economy is the cause of most infections. Now, we're talking about over 300 clusters. Last year during the MCO, we didn't even have 300 new cases a day. So that's the scale of the level of infections that we have now. And of course, when you have this many infections, we've been talking about 4,000, 5,000 a day. What that means is that the system is really stretched. The healthcare is really stretched. Hospitals are full. There are not enough beds, which means that people who are positive are asked to do home quarantine if your symptoms are very mild or you have no symptoms at all. I mean, we know that this is not the best way to regulate people, not the best way to police people. If they are at home, they might meet the delivery guy for their Grab food. They might spread it to relatives, so on and so forth. It's never as safe as in a hospital. So we are trying to contain it rather than eradicate it this time. And obviously the containment is not working. What's happening is, if you look at the numbers clearly, people are passing it on faster than they can be treated for the disease.
Shannon, we understand new measures under this MCO extension will be announced. Any idea what they could be?
Well, we've got sources from both the government and in the economy, from industry sources, telling us that basically a lot of businesses are going to be open. If what they did before was have a list of stuff that can be open, now they're going to have a list of stuff that can't be open. So it's going to be a much shorter list. But what they're going to do is basically have stricter SOPs and more aggressive enforcement, more aggressive policing. So if, say, for example, before this on a factory floor, you would have to, stand 1 meter apart. They might do it 2 meters now. If before you could put 6 or 7 workers in a van to transport them to the factory, now you can only put 3. It's going to be costlier, but it's also necessary. What they want is for the workplaces to stop creating, tens of thousands of cases. They've literally been responsible for tens of thousands of cases. So, of course, what we need is better compliance. If the workplaces, this is what people are saying, if the workplaces have caused so many clusters, clearly the businesses, the employers themselves are not serious about adhering to best practices, about adhering to guidelines. So we're probably going to see a lot more cops going into workplaces, things that we didn't really want to see before. It seemed like an invasion of privacy. It seemed like, being very intrusive and disruptive to business. But we're in a situation right now where businesses are the main cause of infections. We have to get them in check.
Right. Well, on the vaccine front, Malaysia is expected to receive the first batch of the Pfizer vaccine on February the 26th. Shannon, we're seeing other countries having trouble with their vaccination drives, whether it's logistical, operational, or just people unwilling to get inoculated. Does Malaysia face the similar problems, and how does the government plan to roll out the vaccines?
Well, as far as vaccine hesitancy in Malaysia goes, it's not too bad. I think the studies show that somewhere from 2/3 or even more than 2/3 are happy and willing to take the vaccine. If you look at people who just outright don't want to take it, I think it's something like 17 or 13%, below 20%, less than 20%. And given that our target is to vaccinate 80% of the population, maybe that might work out, in the math. I think when you drill down to the numbers, you'll find that there are a number of people who say they don't want to take the vaccine, not because they're anti-vaxxers or they think that the vaccine is bad for them. There is this uncertainty about side effects, yes, but I think largely people are wondering, what's the real benefit? I'm going to inject this thing into my body. I don't really know what it is. Then what do I get out of it? It doesn't seem as if it's going to ensure that you can't pass it on to other people. I think that's the current science. It just means that you have less chance of dying. People are wondering, it doesn't mean I can travel internationally. It doesn't mean I can change my current new normal stuff. So what's really the point? I think that's where the government is struggling to convince people this is good for you, because people are asking, so why is it good for me? The only thing that the government can say is that, well, less chance of dying from COVID-19, but this data shows that 85% of people don't even develop very acute symptoms for COVID. As far as logistics are concerned, we did a dry run last week. We sent a plane, and we managed to keep the ultra cold temperature that's needed for the Pfizer vaccine all the way to Belaga. That's one of the most remote districts in Sarawak. So we are able to send it all over the country and to reach the most remote people. Yeah. Of course, this is just one dry run. I think Malaysia is planning to administer something like 50 million doses by the time we are done. So that's going to be a different level of logistics involved. So we'll see. But so far, there hasn't been any real problems. There was some issue with the EU ruling about export authorization, but the governments met with the relevant ambassadors, and that seems to be sorted out.